this lesson we'll learn about the most common infection of the eye, conjunctivitis. We will talk about 4 kinds of common conjunctivitis in clinic: bacterial conjunctivitis, viral conjunctivitis, allergic conjunctivitis, and giant papillary conjunctivitis. Okay, the first one, bacterial conjunctivitis. There are many kinds of pathogens. In clinic, we call it red eye. Through contact transmission, the clinical presentations are acute onset of redness, with or without chemosis. In severe cases, we also find subconjunctival hemorrhage. Most patients will have mucopurulent secretion. Sometimes they can hardly open their eyes. When they feel uncomfortable, they inevitably rub their eyes. That transmits the disease from one eye to the other. Eyelids and the cornea can also be affected. Let's see some pictures. Conjunctival injection or conjunctival congestions. The blood vessels extension more severe, closer to the fornix. We call it red eye. The second picture, this white line is typically mucopurulent. And the picture below, we can see large amount of purulent secretion all over the conjunctiva. We call it hyperacute purulent, which needs treatment as soon as possible. Treatment: eye drops 4 to 6 times a day, and oculentum 1 time before sleep. In severe cases, use systematic antibiotics and topical steroids. Viral conjunctivitis. The most common pathogen is adenovirus. But during this COVID-19 pandemic, we know that coronavirus can also cause conjunctivitis. Patients may have no fever, no cough, no respiratory syndrome. At early stage, they may see doctors only because eye uncomfortable. Clinical presentations are conjunctival congestion, follicular chemosis, watery tearing or tear-like secretion, sometimes with lymph nodes enlargement. For viral conjunctivitis, cornea is more likely to be affected, known as keratitis, which can cause vision loss. Epidemic keratoconjunctivitis is the most severe type. Eyelid edema, conjunctival hemorrhages, chemosis, and pseudomembranes. Why we call it pseudomembrane? It's not a real membrane because we can take it off without bleeding. And keratitis. We can see many white points on the cornea, which will influence the vision and need treatment as soon as possible. The treatment: reduction of transmission risk. Wash your hands and keep your eye clean, keep social distancing, and improve immune system. The topical steroids. Be careful when we use steroids, especially the side effects, such as high intraocular pressure, glaucoma, cataract, and so on. We can also use giant-cellular eye gel for treatment. Allergic conjunctivitis. This disease can be caused by all kinds of allergens, mostly from environments such as pollen, dust, catkin, and so on. The typical presentation is itching and swelling. When patients rub his or her eyes, we can see severe chemosis, like the pictures. And remember, the more rubbing, the more itching. The treatment. The most important thing is to avoid allergens. So do not rub your eyes. Wash your eyes with cold water can make you feel better. We can also use some eye drops to relieve the symptoms. Giant papillary conjunctivitis. Nowadays, more people suffered from this disease because the use of contact lens. The clinical presentation is a foreign body sensation. We can see many conjunctive follicular. The treatment. Stop using contact lens. We also use some non-steroidal anti-inflammatory, short for NSAID eye drops. In the end, I must emphasize that all the medicines in the PowerPoint are used in our department, but different countries or different hospitals may use different medicines. So for you, the most important thing is to remember what the disease is, why it happens, and how to treat it. Okay, that's all for this lesson. Thank you for your attention. See you next time.